The Northfield Holistic Health Summit 2024 was pleased to host Dr. Kaas on the topic of functional neurology. This is a recording of the breakout session held at the Health Summit on May 4th, 2024.
Patients struggling with brain fog, concussions, vestibular issues, cognitive decline, and other forms of neurodegeneration. The goal of this presentation will be to share several foundational aspects of functional neurology and how they can be used to help patients suffering from neurological conditions ranging from concussions to cognitive decline or dementia. Please welcome Dr. Kaas as she presents Functional Neurology in Practice. Functional Neurology in Practice, Dr. Kaas.
A little bit? Okay, working on that. Perfect. Well, first, thank you so much for coming and listening. This is something I'm very passionate about, and I could probably talk about all day, but we're going to try and fit in as much pertinent information as we can in about 50 minutes here. So we'll get started. First off, we'll talk about, well, what is functional neurology? So a little bit lengthy explanation here, but basically a healthcare specialty focused on the assessment, quantification, and rehabilitation or treatment of the human nervous system, utilizing sensory, motor, and cognitive-based therapies to promote neurological plasticity and functional optimization. Okay, so what does that all mean? Next slide. So this, and how I actually use it in practice, basically boils down to using a comprehensive and dynamic physical examination, where I actually examine and work with the patient to assess their abilities and then observe their responses to multiple stimuli. So what that even means, what am I looking at? What am I assessing? I look at eye movements there. I test their balance, look at their proprioceptive system, how they respond to different movements and things. Test their vestibular system, their awareness of where they are in space, especially with movement. Testing the autonomic system. I consider that kind of all the different things that are going on in our bodies that we don't necessarily think about. Things like blood pressure, heart rate, respiration rate, our temperature regulation, all of those different things. And then also their movement. How are they walking? What is their gait like? Are they balanced? Is there any disorientation? So this is just a small selection of the different things that I'm looking at when I'm assessing a patient. Go ahead, next slide. And why am I even doing this? What is the point? Finding out these little dysfunctions where things aren't going well? Well, the whole point is, because then you can go in and build neuroplasticity. So what neuroplasticity is the ability of the brain to reorganize its neural connections, structure, and functions in response to internal and external stimuli. So what that actually means is you can put in stimulations into the brain, external, internal, doing different things, which can cause different reactions or different neural networks to fire up and help the brain reorganize. Not so very long ago, we used to be told that the brain, once it was fully developed, that's what it was. That's what you had. It would never change. If there was any damage, anything like stroke, concussion, hypoxic injury, anything that insulted it, there was nothing to do about it. It was what it was. We know so much better now. We know that through neuroplasticity, we can have adaptation to new information, and our brains can actually change the way it works, have new functionality, or improve pre-existing functionality. The tenet being with that, neurons that fire together, wire together, meaning like when we put in a stimulus, there's a whole neural network in the brain that goes off, and when we fire that system with some repetition, we can start to see changes. So next slide. So what is what I'm looking for, or what are the things I'm assessing, or what is even the whole point of the functional neurological examination? Well, we know that our brain gives us an output. We get movement, we stay balanced, we're able to react in our environment, but that is all highly dependent on the inputs that we put into the brain. So 3 core ones I'll be talking about today is input from our vestibular system. That is our inner ear. You can kind of see, so that's the external ear there. On the inside, we have this little semicircular canal system. And that system helps tell our brains when we're moving and detects motion and then helps us keep balanced with that motion. We also have our ocular system or our visual system here. That obviously gives us all of our visual information about our environment so that we can respond and react appropriately to it. And then our proprioceptive system. So that is basically our bodies, our muscles, our joints. They give us good feedback and good information that then also helps us respond appropriately to our environment. And so all 3 systems here need to give accurate information into our brains so our brains can take that information, put it together, and then we can have an appropriate response. And where things go wrong, I kind of like analogies with these kinds of things. Just helps me explain it, helps me understand it better. So my analogy with this kind of concept is, say you're having a party at your house. You have 3 friends there, and you leave the room for just a second, go answer the door, you come back, and all of a sudden, the ceiling's caved in, the table's tipped over, the window's busted out, and you ask your 3 friends there, well, what happened? And friend number 1 says, well, the other 2 got in a fight and caused utter chaos. The second friend is like, no, it was actually a tornado. Tornado came in, cyclone, spun everything around, caused a lot of damage. That's what happened. Your third friend is like, no, actually, it was aliens. We all have that one weird friend where anything goes. So you have 3 friends telling you 3 different things that happened. And now it's your job to put that information together to figure out, well, what actually happened? Do I have to file an insurance claim? Do I need to find new friends? Like, what do I do? Which can be like very time-consuming, very frustrating. So that's what happens to the brain when it doesn't get appropriate inputs from these 3 systems. Bad input leads to kind of not appropriate output, and that can change how we experience and how we move in our day-to-day life. On the flip side of that too, though, I circled this little area here called the cerebellum. That's a pretty important part of the brain because what that helps us do is that helps us take these inputs and it modulates them or it gates them. It kind of cleans them up before sending it on. So even if there's bad inputs, sometimes it can compensate. But sometimes this area itself is not functioning appropriately. So then you might be getting good inputs in, but they're not being modulated or cleaned up appropriately before being sent on. So again, your brain is going to be getting bad information. And so the analogy I like with this one, I consider the cerebellum, or this area here, to be kind of like that babysitter or that pre-K teacher who is kind of monitoring a room full of toddlers. So of course, when the teacher's present doing their job, keeping things kind of not chaotic, everything's going well, toddlers are working together, things are fine. Teacher steps out or not paying attention, now all of a sudden you have utter chaos. You've got kids breaking crayons in the corner, you've got one that's maybe wandered off down the hall, inevitably there's one maybe sitting there eating paste. So again, you have to have good kind of oversight of these functions as well. So good input is going to lead to good output, and that is kind of a core tenet of functional neurology. What are the inputs? Where are they going wrong? How do we improve them to then improve the outputs that we're seeing? So next slide here. So then we'll talk a little bit more about these inputs and outputs. So we have that vestibular input, and again, that is associated mainly with like our balance, our motion. It's going to help us walk or have good gait. It's responsible for what's called a vestibular ocular reflex. Can we keep our eyes steady on a target as we move our head? That's actually a really important feature of being able to navigate your environment. Helps us with our visual motion sensitivity. When we're moving, we experience motion, but sometimes we're standing still and our environment is moving in front of us. We have to be able to navigate both or a combination of both situations. And then there's our autonomic function. Again, all those things that we don't necessarily think about. Do we have appropriate blood pressure for the position we're in? Do we have a heart rate that's appropriate? Are our vessels constricting and dilating like they should be? Is our temperature regulation what it should be? So all these things are really important, and vestibular input kind of helps determine a lot of those different inputs. So we'll take a little bit closer look at that one. Let's do next slide. Let's do one more forward. We'll advance it forward. There we go. Because we'll be coming back to that slide. We'll see it later on when we talk about the individual systems. So with this vestibular system, again, we can see it there. There's our outer ear there, and in there we have that canal system. And what it helps us do is when we are experiencing motion, it lets us our brains know that, hey, we are moving. And then that lets us respond so that we can stay balanced and activate the right muscles to stay upright or do the motions that we want to do. So again, it helps with our visual stability. It's really important when we're moving, if we want to look at something, to be able to stay focused on it even when we're moving. If that is off, we can experience kind of dizziness, disorientation, even vertigo. There's that balance, so even just not on solid ground, we need to have the ability to stay upright and in the positions that we want to be in, so that vestibular system really helps us with that. Even spatial orientation, when we're on things like playground rides or roller coasters, rides at a fair, it's that vestibular system that helps kind of keep us basically feeling like we're on Earth even when it gets really, really overstimulated. And there is that autonomic system. So again, when we change positions from like lying down to sitting, we need to have appropriate responses with the things like blood pressure, heart rate, and all of that. And so here are some of common dysfunctions. There's many different ways or many different things that can impact the vestibular system, but these are some of the more common ones. BPPV, if you've ever heard or ever experienced or ever talked to someone and they're like, oh, I had crystals in my ear and I was really, really dizzy. That is the classic BPPV presentation. Meniere's disease, that's another dysfunction that can lead to things like drop attacks. Then we can have acoustic neuromos. Those are like non-cancerous tumors that can grow on the vestibular system. Vestibular neuritis, labyrinthitis, those are just inflammation or infections of the system. Something really interesting called Mel-de-Bark syndrome. That, if you've ever experienced or ever heard someone say, I was on a boat or I went on a cruise, I got off, I was on solid land, but I really felt like I was still on that boat for some time afterwards. That's a dysfunction of the vestibular system. And then last but not least, dysautonomia. So that's kind of a blanket term for all the different things that can go wrong with the autonomic system, just in regard to your movement or your vestibular input. So let's see the next slide here. Next slide. No, thank you. So the next one we'll talk about is going to be visual input. So these are some of the common complaints with vision. So if you have poor input from your eyes, things might look blurry. And it's not necessarily that your acuity has changed, so it's not necessarily like your prescription has changed in your glasses. Sometimes it's the movement and the ability of the eyes to focus. Reading can become difficult when people have issues with eye movements. They'll say that they get more fatigued with reading, even reading retention. So these are the people who are like, I need to study, and studying used to be easy, but after some type of injury, they're the ones who will read 2 pages, and by the time they're done with the second page, they've already forgotten what was on the first page. So many difficulties with reading, not just the physical part of reading. People with poor visual inputs will maybe have difficulty in crowds. It's that visual motion can be a lot to take in, and it can be very overstimulating. Double vision is a common one if you have changes in your eye position. And that can lead to things like headaches, and even trouble driving. These are all things that are kind of common complaints that I hear about from my patient base. And when we look into it, a lot of it's due to the poor visual input. So let's see the next slide here. Thanks. All right, so this kind of gives a little bit more of a breakdown of that visual system. So we have our eye there, and then that transmits back to the brain about what we're seeing. And again, it's really important for it to give good quality, accurate information to the brain, because if it doesn't, the brain has to sit there and figure out, well, what I'm feeling kind of proprioceptive-wise might not be matching up with what I'm seeing, and then it has to make that determination of who's right, who's wrong. Add into that vestibular function too. So is what you're seeing matching up with whether or not you're moving or not, or whether or not a crowd is moving? So a lot of complex interactions here, but at the end of the day, it's that input that is really, really, really important. So common dysfunctions we see when there is eye input issues, things like nystagmus. So that can be when the eyes are just moving, and even some more subtle versions of that, gaze stability. So they might not have to be like big motor movements, but even just tiny micro oscillations when the eyes can't stay steady on an object. Basically, when you're trying to look at something, if your eyes are oscillating, that's telling your brain that your environment is oscillating. And now your brain has to try and figure it out and respond in kind, essentially. You can have what's called convergence insufficiency, so the inability to bring your eyes in together to look at something close up. And that's one more thing that can impact reading, give people headaches, give them eye strain. And then optokinetic intolerance. So that is kind of the inability to tolerate that visual motion out there. These are the people who just don't feel good with a lot of like visual stimulation. Even things like movies will start to not feel so good to them. It's just too much input for them to kind of be able to absorb. And then even poor reaction times. You really need quick and accurate eye movements in order to be able to respond to your environment. Sports is a great example. You have to be able to track moving players, track moving equipment, balls and things like that, a pitch that's coming at you, watching a throw. All these things require just these really accurate eye movements, and if they're off, you can have poor reaction times, which means you might not adjust yourself to avoid a hit quickly enough. That opens you up to injuries and things like that. So these have so much more to do with our brain and good output than just being able to see clearly. So let's see the next slide here. All right, couple of videos that actually go along with the eye motions I was talking about, because sometimes it's hard to visualize or think about, what do you mean like eyes are moving? Aren't our eyes steady all the time? Not necessarily. So let's see that first video. We'll play it and I'll kind of explain it. So this is utilizing some technology where this patient is wearing a set of goggles that's video recording their eyes as they're watching something play across a screen. So what this person is watching is basically a steady ball just going back and forth across a screen. And they're trying to track it just with their eyes. So can we play it again and just kind of see what we see here? And mind you, this ball isn't jumping or anything, it's just nice and smooth. So can we kind of see how they're a little bit jerky here and there? So they're getting off target at times, or skipping ahead or lagging behind. So this is what I mean by poor pursuits, or being unable to fully track an object. And every time your eyes fall off that object, even for just a split millisecond, that's a moment in time that your brain doesn't have that good information coming in, and it's kind of got to fill in the gaps here and there. So let's see the next video of different eye movements. So this one's pretty obvious. This is more of a nystagmus than a subtle gaze instability. But this person is just trying to keep their eyes steady on a target. And some people, when it's micro movements, they're not even aware that this is something that's happening. So they have no control over this. They're not trying to do this on purpose. It's just something their eyes are doing. And as I mentioned before, if your eyes are doing this, and that's kind of the input you're giving your brain is then thinking that, oh, maybe my environment is doing this. And now you're going to have all the outputs that go along with that. So that's going to impact how you walk, how you move, which muscles tighten up, whether or not your brain thinks you're going to fall. So at the end of the day, your brain's main focus is trying to keep you upright and balanced and safe. So it's going to try to do the best it can based on the inputs that it's getting. So this is just another example of a very bad input. We see this more often than you might think. So let's see the next video. Okay, and so this, when I was talking earlier about kind of complex visual motion, these are a couple things that, some of us might take for granted if we have good inputs. But with this optokinetic response, what we'll see here in a minute is as we're moving through our environment, we are always getting moving visual stimulation. And if we don't have the good input or the good ability to properly kind of track that and take that in, that can make us feel really terrible just by being out in our environment. So let's take a look at that first video. So this is just video of what someone experiences going to a grocery store. So we can see there's a lot of visual motion. When you're in a grocery store, if you're looking for something, you're turning to look. That's probably a lot of vestibular input. If you're reading something close up, like a nutrition label, that's that convergence. If you're trying to look at something far away, you have to be able to have appropriate eye movements. So just a very, very complex environment for us to try and navigate. And when we don't have those good inputs or that good capacity, something like this can really fatigue us. It's common for me to have patients who say, I get up, I go to the grocery store, I'm either there first thing in the morning or right before it closes so that there isn't a lot of people around, it's quiet, I feel better like that. I go, I do my shopping, and by the time I'm done, I'm already tired. By the time I get home, unpack things, I'm exhausted, and then I'm down and out for the next 1 or 2 days. This is incredibly fatiguing to someone who has, some form of brain injury. And I hear that all the time, and when you think about it too, how is this going to impact their nutrition? If they're already having trouble kind of navigating the grocery store, are these the people who are going to then go home, follow a multi-step recipe, make something from scratch? No, they just don't have the capacity to do something like that. So that's why it becomes so important to be able to rehab these different kind of insufficiencies that we see. It impacts basically every area of their life. So let's see another example, next video here. So this is something else that a lot of us might take for granted. Probably most of us got here by some form of either driving or being a passenger. Think about all the complex things that we're having to take in as we're driving. So with the driving, again, you're getting a lot of that visual moving motion, those optokinetics, things like posts along the side of the highway or trees that are planted in a line, the road lines themselves, that's a lot of visual stimulation. And at the same time, you're in a moving car and there's moving cars around you. And then you also might be doing things like looking at something close to you on your dash, and then looking a little bit farther at the car in front of you, and then looking even farther, trying to read a road sign. So just a lot of complex things are going on when we're just trying to drive from point A to point B. And then another thing worth mentioning too is with the different inputs and things, our visual spatial representation can be thrown off. Basically, our ability to accurately determine how close am I to something? How far is something coming from me? How quickly is it approaching me? So especially with driving, that can throw a lot of people off. If you know anyone, have a friend or family member who's constantly curbing their car, bumping into things, not the best parker, maybe they've had multiple fender benders, and you're like, oh, it's time to take their keys away. Not necessarily. It's not necessarily that they're a bad driver. Sometimes these inputs and there's mismatches and there's so much more going on that they're trying to have to navigate, where it's like, if we actually worked with the brain rehabilitation side of things, we could see improvements in these items here. All right, let's take a look at the next one. All right, so other common complaints with dysfunction. So common complaints with proprioception dysfunction. So patients will often say, I don't feel as coordinated as I used to be. I feel a little like unbalanced. Maybe they're not falling over per se, but they just don't feel like very grounded or very comfortable. They might have increased joint pain or chronic muscle stiffness for no reason. These might be the ones who get consistent chiropractic care, massage, they stretch a lot, but it's still very tight. That has a lot to do with how our brain and body are perceiving things. Fatigue is very, very, very fatiguing, and that's actually, one of those things that could go in a lot of the complaint columns, but with proprioception especially, when we are posturing in different positions, trying to keep ourselves upright or keep ourselves from falling if our brain thinks that due to the other inputs that we, might be unbalanced or might be in an unsteady environment. It's actually very, very tiring for our body to keep us upright and keep us tight and keep us from falling over. Oftentimes, we'll see changes in gait. How we walk says a lot about our different inputs. If you've ever gone to a store, an airport, whatever, and just watched people walk around, you might notice some difference. Some people might take little kind of shuffling steps. Some people might be kind of bent forward. Other ones might have kind of arms out for stability or be using something like a cane or bending over their shopping cart for better stability. These are all things that can happen due to kind of poor proprioception. And what exactly I mean by proprioception is most of us, we would know if we closed our eyes, like whether or not we were laying on the floor, sitting in a chair, or standing up. Also, if I had told you to close your eyes and raise your right hand, most of you would know that, hey, I'm doing that. I'm not seeing it, but I can feel this. That's proprioception. So that is your ability to know where your body is in space, even though you might not necessarily be seeing it. So that is a very, very important thing for us to have good awareness. Bad proprioception as well. These are the people who don't do well walking in the dark because now you've taken away that visual aspect of things. They can't see as well. So now they're really destabilized and disoriented, and they might, be a fall risk or run into something or injure themselves. So really, really, really important to have good body awareness, good body feedback. Pain is another thing that can happen, especially with that chronic muscle stiffness, when you're always tightening up because you think that, your brain thinks at least that you might fall over. Your center of gravity has changed. It's going to tighten up again just to kind of keep you upright, keep you safe. The last thing your brain wants having to happen to you is a fall, because absolutely that risks another type of brain injury. Slip and falls are one of the leading causes of concussion-like brain injuries. So your brain is going to do whatever it can to protect you and keep you upright. And then underlying it all is something I hear quite a bit about, and that's anxiety. And these are patients who are like, I have no reason to be anxious. There's nothing wrong in my life. I don't really have anything to worry about, but I always have kind of this underlying feeling of like, something's not right. I don't feel quite right. I have a little like anxiety that just I can't shake. And when people go the traditional route, they might be prescribed an antidepressant or an anti-anxiety medication. They might try it and they'll come back and be like, I don't really feel much different. I still have that underlying sense of like, something's not right. But when you think about it, any one of these inputs, when it's not appropriate, again, that's very hard on the brain. Just like at that party, you have to figure out, well, what happened? What actually happened? Who did what? Your brain, when it gets all those different inputs, has to be like, well, which is correct? Or which is most correct? Is it the vision? Is it the vestibular input? Is it that proprioception? These are all things that it has to be thinking about. And when it's getting kind of multiple stories, that can be kind of anxiety provoking. So a lot of times, yeah, this is something people will mention after different brain injuries and things. All of a sudden, I don't feel like myself. So let's take a look at next slide here. Okay, and so these are some of the common dysfunctions that we see with proprioception. Neurodegenerative diseases, they can lead to proprioception errors. So most commonly, we see with like the classic Parkinsonian's gait. What happens with Parkinson's is proprioception-wise, your center of balance changes from being more upright to it feels like it's more posterior. And when it feels like it's more posterior, it kind of feels like you're going to fall backwards all the time. So now, to compensate, they develop posturing, which is called camptocormic here, which is a little bit more hunched over because they are just, and they're unaware most of the time that they're doing this, but they're just trying to prevent themselves from having a fall. So then they adopt this posturing. And what does this posturing then lead to? Usually tightness on the front muscles of the body. So these flexors, because they're always activated, they can get really tight. That can lead to different areas of pain. The low back and the extensor muscles of the back, they get stretched. They can get weakened. That can lead to things like chronic low back pain or leave you open to more low back type injuries more easily. They often adopt what's called more of like a shuffling step. So again, small little steps. Because if you don't have good awareness of your body, your joints, your environment, you're just going to adopt a posturing that feels safer, essentially. Other things we see is basically one of the first signs of neurodegenerative disorders is slowed movement, so gait that just slows down. That's kind of one of the first things we'll see, or gait or movements that are more hesitant, essentially, just not as confident as they used to be. So that's where that becomes really important. And honestly, when I start a new patient exam, my exam starts in the waiting room. I always go out and get my own patients, greet them, bring them back. Reason for doing this is I can see, how are they getting out of that chair? Are they having to really use a lot of assistance? Is it slow? Does it seem hard? Once they're up, are they kind of like unbalanced? What is their gait like back to my office? Is it that small shuffling? Are they picking up their feet? Do they walk with more of a lean or a tilt or appear to be kind of more unbalanced? These are all really important telltale signs of what's going on. Other common dysfunctions, can we go back one? Perfect, thank you. Movement disorders. These are things like either functional movement disorders or things like Huntington's disease or other neurodegenerative issues. Those will change your proprioception or how you move. Neuropathies, that's actually a really common one. The most commonly seen being things like type 2 diabetes or MS, multiple sclerosis. Both of those will impact nerves or nerve firing. They cause a lot of like nerve degeneration or inflammation around the nerves. And the nerves, especially in your legs, your lower legs and feet, they're transmitting information up to your brain about movement, about kind of what is under your feet. Is it a solid surface? Does it feel more like sand, or does it feel more like a pillow? So when we have different neuropathies and things, that information can be not so very accurate. So that's also going to change how you walk and how you move. Just injury and pain, that's going to change how you move, how you walk, even post-surgery. That absolutely changes the kind of information your brain gets from the different joints, even after they were fixed or replaced. Decreased body awareness is a common dysfunction. And it sounds kind of bizarre or out there, but it's like, do you know where you are in space? I have a lot of patients, when I break it down and I test it, no, they're not so good. So kind of how we look at that is taking away that visual system, so eyes closed, and then what we do is kind of touch them on an area of the body and see if they can go in and touch exactly where the practitioner touched. And you would be surprised. Touch right there, a lot of them, very far off, by inches. So that just lets us know that their interpretation of where their body is in their brain is maybe not so accurate. And that's a big deal, because when you have inaccurate information about your body going up to your brain, then that output, that thing that we need to be so very good, can be changed. Decreased body awareness can lead to kind of repetitive injuries, and kind of an extreme example here, phantom limb pain. If you've ever heard of that or ever talked to someone who's experienced that, it's awful. People who have lost limbs due to, traumatic injuries and events, they will sometimes report that, that missing limb, it hurts, or it itches, or it's burning. Well, how can a limb that's not even there be causing you pain? That's a brain-based proprioception issue. If your brain still thinks it's there and thinks it hurts, it's going to tell you that it's there and it hurts, even though it's not there. So that's why it's so important to have just great awareness of where your body is in space. So let's take a look at next slide here. Thank you. So again, it really comes down to these different inputs here, that visual input, that joint or that proprioception or sensation input, and then that vestibular input. So all these things tell us, are we moving? Is our environment moving? What kind of surface are we on? How are we walking? How should we be walking? How should we be activating muscle patterns? What are we seeing? Are we able to have appropriate eye movements and judge distances and speeds well? So all these different inputs come into our brain, and if they are dysfunctional, there's different things that we can do to build neuroplasticity, to improve them, or change them, or get them to work better, or integrate better, or give more accurate information. These types of activities look like things like visual vestibular rehab. So those are basically exercises that help retrain your eyes and your vestibular system back together. Cognitive stimulation, making sure that we're lighting up really important areas of the brain. We can do gait retraining. We can actually retrain the body how to have good motor movement. Electrical stimulation. We can go in and we can stimulate the different nerves so that they can then in turn have better inputs or more awareness or more sensitivity to their inputs. And things like balance training, retraining your body to understand where its center of gravity is, what it needs to do to stay upright, how it needs to function to keep you from falling, but not in kind of an aberrant way. So with these kind of changes to the inputs here and making them better, especially with neuroplasticity, we can have better outputs here, better cortical awareness of head-body motion, which is going to mean we have better movements, better ability to avoid falls or avoid injuries, less risk of things, better control of posture there, which can lead to reduced pain, reduced low back pain with better posture, and then better control of motor skills, so better movement. It's really important with sports and things, but also everyday life, it's really important. And I think one of the most important things that this allows us to do is give patients back their autonomy. If you've experienced or you know anyone who has experienced kind of dysfunction in any number of these areas, they might rely on someone else. They might be in a state where, they can't drive, or that grocery store situation, which kind of takes them out for a day or two. They can't maybe cook for themselves. They're always fatigued. That can really change your whole life function. So when you can get these things better, one of the best things that I feel like we can do for kind of humankind at large is giving them a better quality of life, giving them more independence, letting them have better access, better control of their brain inputs and their outputs. So that's something that really drives me, keeps me going, why I keep doing this kind of work. Because again, we used to be told brain doesn't change, but we know without a doubt now it absolutely does. It just needs the right activities, the right stimulations, the right kind of considerations, and then we'll see really big, impactful changes. So let's see, next slide here. So again, what is functional neurology? Kind of wrapping it all together. Hopefully this makes a little bit more sense now. So a healthcare specialty focused on the assessment. So the assessment, again, looking at eye input, vestibular input, proprioceptive input. We quantify it. We look and we see, well, what's not working right? Why isn't working right? We can measure kind of how much it's not working right. And then we rehabilitate it, or we treat it. We treat the nervous system. And we do that using sensory, motor, and cognitive-based therapies. We use the stimulation, so either the eye input stimulation, vestibular stimulation, and even body or proprioceptive stimulation, all in different and unique therapies. And then we promote neurological plasticity and functional optimization. So getting these things better so that someone can, operate as intended and function as intended. So that is the whole point of what we do. Next slide. Perfect. So that is what I have for you today. Hopefully you got a little pearl out of there, or at least an understanding of maybe when you hear different symptoms or different complaints, or even when you experience different dysfunctions, that, hey, there is probably a reason for it, or there is something behind it that's driving it. It's not that you're dizzy for no reason, or you're uncoordinated just because you're getting older, or your driving is off just because you're a bad driver. There can be reasons behind these things. So important to find a practitioner who can help you to discover kind of what might be behind these different dysfunctions, and then help you find that neuroplasticity, or develop that neuroplasticity, so that you can see improvements in all these different areas. So that is my information, where I'm at. I will be here all day. If you have any questions, comments, want to talk about anything, want to tell me how great my analogies are, I will be here for it. So hopefully I'll be chatting with some of you today. Thank you so very much. I appreciate it.